one of my family members was the top doctor in the world, and they were being forced to not get their full market value.
I'd be like, you're a doctor, bro. See, you just said perfectly my issue.
Yeah.
Is like the doctors should exist outside of a market. It shouldn't be market. Like the medical field, the healthcare should not obey any type of fucking market. Mm-hmm. That is patently, I think, immoral, honestly. And here's another one about Abdul. Mm-hmm. Big Medicare for all guy.
Yeah.
That's a big
which
thing
I support. That's probably my most Democrat socialist position. Is that I do
okay, all right. You support. Yeah. But you're of the mind nobody gives a fuck about that.
No, I'm of the mind that when running for president, a lot of people will hear that idea and associate it with socialism.
Oh, no. I remember you saying that you're like, that's not an issue people care about. Like, we had the whole argument.
Yeah, I don't think
fucking Jane and John Doe.
I don't think there's a shit ton of people.
This is kind of a switch from what you were saying.
Okay, let me be clear. Let me be extremely clear. In my ideal world, Medicare for all would be a thing. We would have Medicare for all and let me be clear. Medicare for all for people who want it. If you want private health care, you should have a right to get that. But everyone should have the option to have cheap, affordable health care. And I have said that before.
I honestly have a hard time with, if you have more money, go get better health care. I don't fuck with that at all.
Interesting.
You fuck with it? I don't fuck with it at all.
I don't have a big problem with it. I really don't.
You don't have a big problem with just like rich people having better health care? Because that's what that is. That's what it is.
Everyone is entitled. Okay, here's the thing. You can never make somebody else's labor your right. And so for that reason, like, I don't think that healthcare
firefighters
is some fundamental right. Yeah, cops.
Oh, you don't think that's actually another cute. This is where it's
I don't think it's like a human right the same way that freedom and liberty is. No. I disagree with that. Because you can't make somebody else's labor your right.
I feel like we do that.
Like when? With firefighters and police?
Yeah.
Okay. If you call the police and they don't show up for an hour, is that a violation of your rights? No, it's not.
No.
So it's not a right. I mean, you do have some... Yeah, it's not a right. Actually, having a firefighter is not a right.
Say your argument again. You don't have a right to people's labor?
Yeah, you don't have a right to somebody else. Somebody else's labor can't be your right.
Is there an example of someone's labor being your right? I don't know. I mean, if it's not the case, I mean, I just do think
a few different senses in which this comes up, depending on what you mean. Contract-based claims. Okay, we're not talking about that. Indentured servitude.
State-imposed claims, military conscription, draft, prison labor.
Yeah, but that's like the right of the
chattel
state.
Slavery. Some political philosophers, blah, blah, blah. All right, so there kind of isn't really one like that, but I think there should be. I don't know what to tell you.
Yeah.
I like that. If it's like, the hospitals can't deny you service when you go.
No, they can't.
So it's like,
that
effectively is you having a right to
But that also doesn't mean you're getting the highest level of service possible, right? Like, there's always going to be some doctor in a private practice that might know more about a specific topic, right?
That isn't always.
Really, the person at your local hospital is always the most advanced person on that specific...
Oh, yeah, sure, but paywalling that is where I'm like, that's fucked.
Paywalling the top-level specialists?
Yeah. I don't like that at all.
There's only so many top-level specialists. You can't have a top-level specialist on every surgery.
I agree. I'm not saying that. That's obviously fucking clearly not possible.
But you said that every person should have equal access to healthcare.
Yeah.
Well, based on some doctors are just way better at certain things, you're never going to have the highest level for everybody.
Oh, sure.
Yeah.
Sure. But the way we decide, or the way that it gets divided currently, is rich people get the best. Yeah. And that's it.
Yeah.
And I have a problem with that. It should be distributed a completely different fucking way.
Okay.
You don't agree?
Well, here's my thought. let's say that you have a world leader in lung cancer. He's like the top doctor on lung cancer.
Mm-hmm.
If, like, how are you going to decide whose cases he works on in your ideal world?
In my ideal,
It would be like random or luck of the draw.
Honestly, fucking.
I don't have a
luck
big
of the draw
issue.
versus just who can pay for it. Yeah, I'd go luck of the draw.
Okay, so you have a big issue that like the top doctor on lung cancer is treating the richest person that has lung cancer. Like to you, that's
Yes.
unjust.
This is unjust.
Okay.
Is that not unjust to you?
I don't think it's unjust.
Yeah,
it would
that's
be
crazy.
it would be unjust if like that person can't find anyone that is a doctor that handles lung cancer and knows how to treat it. Then it would be unjust. But
So you like a system where it's like, all right, there is Medicare for all.
everyone
Hey,
has
here,
access.
let me try to pitch
go
your
right ahead.
thing to you.
Yep.
There is Medicare for all. All right, if you need a doctor, you go to a doctor, and you're not going to be in debt.
You
You're
will
not-
get someone who's an expert on your
You will have
disease.
a legitimate doctor that fucking
Knows what they're doing,
went to
yeah.
med school, did all the same requirements of today.
Yeah.
But it's not. You're not going to go into debt or whatever.
Yep.
But if you want the really, really good doctor,
Yeah.
you got to pay a premium.
Yeah. I don't have a problem. With
I have a
that.
huge problem with that.
Interesting.
I just have a huge problem with like a different world for
Okay,
rich
here's
and poor
the thing.
people. That's a different world for rich and poor people.
That's
and
true.
I just it's not. I don't fuck with that at all.
I guess it
I
kind
think
of
it's
depends.
absolutely like that doctor should just be in the rotation and be like,
Yeah.
And it's like, oh, you got actually the best one. Like you're fucking in good hands.
Yeah, I don't know. I don't have an issue with the tiebreaker for who he treats being the guy that has more money to give him. I don't have a problem.
I have
with
a
that.
huge. I just that's not a way to.
As
do
long as there's some level of very high quality care that everyone gets.
it. Okay, but that's
Okay,
that's
maybe
a
very
huge
high quality.
fucking caveat. That's a huge caveat.
Yeah.
Because you're kind of creating a situation where it's like, okay, the lowest level's here, and the top guy's here.
Yeah.
That's not going to be the case. It's going to be like there's a fucking
gonna be
top
a
guy,
gap. There
and
is
it's
gonna
a
be a gap.
huge. It's a spectrum. You
Yeah.
can have anybody from the shittiest one to the best one.
Let me ask you this: Do
Yeah.
you feel the same exact way about lawyers?
About lawyers.
Like, are you cool with the richest people getting the best lawyers, or you think that should be luck of the draw too?
Well, here's the thing about lawyers.
Yeah.
Is that's much more of a.
Bigger gap.
No, what I was
You
gonna say
think
is there's like bargains. Like there's a really good lawyer that's coming out of law school right now that just can't charge as much as he wants. You know what I'm saying?
That's true.
Like you can get a really.
But I feel like it's the same thing with doctors. To
You
some
could get.
extent.
You could get.
I mean,
You
experience
can get
matters
the
more as a
public
doctor.
defender that's fucking great.
Yeah.
You know what I'm saying? Like at the beginning of his career, and he's
Yeah.
like he's great.
Yeah.
You can get that guy. I mean, there's also, like, there's also this with doctors, but there is the altruistic people that are like, no, I'm gonna help. I'm not gonna be like private
The
practice.
pro bono ones. Yeah.
Yeah, I'm not gonna be. No, but like I mean, like literal public defenders that are like, yeah, I could get a job for.
Okay.
more
How
money,
about this?
like a
How about
corporate
this?
thing.
How about this? How about this?
No.
Are you? So let's say you're the leading doctor or the leading lawyer in something, right?
Okay.
So you don't think the tiebreaker should be money, right?
Yeah.
Well, what if the tiebreaker is up to that person,
Up to the lawyer.
up to the lawyer or the doctor? Is that
Listen.
fucked up? If the lawyer is like,
no,
I
don't
want to
think-
do
I don't
whoever
think
I
that's
want,
fucked up.
Yeah.
I don't think that's fucked up.
we should be able to
but
leave
if
it up to
you're
the
the
expert.
lawyer that's like, I'm just gonna take whatever
Whoever
pays
has the
more.
most money, yeah.
First of all, lawyers are scumbags. Number one.
Yup.
They're bad people. Stay away
Not
from
all of
them.
them, but yeah, okay.
Fucking 96% of them.
Lawyers are worse people than doctors on average.
Yes.
I'll give you that. I'll
Yeah.
definitely give you that one.
Yeah,
I'll
yeah,
definitely
yeah.
give you
Lawyers
that.
are a special breed of.
But not as
shit.
bad as car salesmen.
No, I
think car salesmen are worse.
I think they're the same. I think
Yeah.
they're one and the same. The difference is one of them put themselves through law school
Yeah.
and passed the bar. Like there's a higher threshold to beat, but no, I think you can be just as sleazy.
So in your ideal world, the best doctor,
In my ideal
should it
world,
be up to him or should he have to do a cycle
in my
based
ideal
on
world,
whoever
in
gets
my
lucky?
ideal world,
Yeah.
we're not ranking doctors.
But some of them are gonna be way better, bro.
Yeah, but like we don't like. It's very easy to not know that. It's very easy for people to just be like, I actually don't know.
Yeah.
Like how do you measure the best doctor?
Well, in terms of like, I mean, plastic surgery, you look at how good the outcomes are.
Yeah.
In breast or in any type of cancer, you look at the results, like how many people
Yeah.
had better outcomes
Okay.
based on each stage that they were in when they began treatment.
Yeah. Great.
Yeah.
So, but like, ultimately, like, there's already a standard of like, if you're not at least this good, you can't do it.
So tell it to me
know what
like
I'm
it
saying?
is. Should it be up to the doctor who they treat, or should they be forced to treat whoever gets lucky, luck of the draw?
Well, to be honest, I don't.
Yeah.
I think in most cases currently right now,
It's the richest.
it's not
which is
up
a
to
fact.
you. It's no. The doctor doesn't get to choose.
Okay.
I don't think that's the case at all.
If
for
you're the number
the
one
vast
doctor in the world,
majority.
yeah. If you work in a
if you're
random
literally
hospital,
the best brain surgeon,
Yeah,
you get
yeah.
to pick right now.
Yeah.
But like most doctors, they see the patient that comes in.
That's true.
They're not being like pass.
Yeah.
They're not like, you know what, pass. Only the fucking private guys are like pass on that, and I don't like it.
Which
I don't
of the
think
best
that's
ones
cool.
are private.
I don't
which
think
is
that's
its own
cool.
issue. That's a
I don't.
separate.
I don't. But you would keep that. You would have that issue keep going.
I don't have a big
If it
problem
was up to,
with it.
yeah, I have a huge problem with it.
Okay.
I don't think the best and brightest should be reserved for the richest. I don't like that. Also, if you're a doctor and you're only in it for like money and shit,
Yeah.
I already am like, I don't want you to be a doctor at all.
I would agree with
actually want you
that,
to
but
get the
that
fuck out
doesn't
of
mean
there.
that we should pay doctors less.
I don't think we should pay doctors less. We should
Yeah.
probably pay them fucking more.
Yeah. I think it's about right now. I think that they're making
Well,
enough.
here's-
I think they're making enough.
Here's what it really is. Is
Yeah.
you should pay like the lower level, like nurses and shit more. And the problem is, what you would say is, well, if the nurses getting paid more, the doctors need to get paid more. To which I would say,
I don't really care
fucking
about
sure.
that.
Okay,
I mean, you know me.
great.
I'm biased because my sister's a nurse, but yeah, I wouldn't disagree with that at all.
Oh, so you would be for paying nurses and shit more and
Keeping doctors where they're at. I'm
where
cool
they're
with
at.
that. Yeah, I'm fucking cool with that.
Alright, that's good.
I'll sign off, get my signature.
Can I be honest?
right
That's surprising.
Yeah.
that you
Well,
have that
my
take.
sister's a nurse, so I'm a little biased. But
Yeah, but like, why does that bias you in favor of not paying doctors more?
doctors get paid enough as it is. Like, I don't care that much.
Yeah.
My only problem would be if we paid doctors less. That I'm like, we should probably make a big incentive for you to become a doctor. It's a pretty important field. It helps society a lot, and we need doctors.
I actually think money is not the only incentive.
No, it's not the only. It's not the only.
Well,
but it is a pretty
my
big one.
Here's my big one.
It's definitely not working
Here's
against.
my big one is we have to like completely change the education system in this country. Like we should get out of high school with like almost like at least like EMT level training. Like I genuinely think we should be leaving high school with like financial literacy.
Yes.
And fucking like health skills that are like minimum health. Like I don't know if you fucking start bleeding, like I don't know a single thing to do.
Yeah.
You know what I'm saying?
Well, you can do the Heimlich on me, yeah.
Yeah, but they don't even do the Heimlich anymore. It's just chest compressions.
Oh, really?
They don't, no mouth to mouth. Oh, the Heimlich. I'm fucking up. See?
Oh no, you're good. You're good.
But case in
CPR
point.
versus
Case in
Heimlich.
point.
Yeah.
Case in point. Like I think like you could have more people trained to do like things if you wanted to, but that's like a way bigger, like fucking yeah.
I think I get where you're coming from, and I think you get where I'm coming from.
I mean I understand what you're saying, but
Like,
I
you're
I
never-
fundamentally disagree.
Yeah.
I think it's bad. I think it's bad for the world to have that set.
I mean, I don't think it's the ideal state, but I do think it's fine to let the top doctors decide who they want to treat based on their own criteria.
I just do
I'm
not.
fine with. You think that they should be they should be forced?
I think the best doctor and the worst doctor should have the same. They should be at the same level.
Sure, but that's not the case. And we.
No, I'm not saying the same skill level.
Oh.
But they should be like treated
In the
like,
pool and whoever.
Yeah, they should be
is
in the
needed
same
will-
fucking.
yeah.
Yes, that's a good way to put it.
I mean,
just
okay.
fully-
I might agree with you in an ideal world, but it's just not something that's important with me.
I feel
and
like
I'm fine
honestly,
with the doctor
honestly,
choosing.
Honestly,
I'm fine with the doctor choosing.
honestly,
for themselves.
I think that like, truly like, you believe that in the abstract.
Yeah.
But the day like someone in your family's in the hospital and the good doctor's over there treating a rich person and you're over here and you get like whoever the fuck,
Yeah.
that's when you'll be like, this is wrong. That's what I think. But maybe you would be like, no, this is right.
Well, what if
Fuck you, auntie.
what if one of my family members was the top doctor
Was the doctor?
in the world,
I would-
and they were being forced
I would feel the exact
to not get their full market
I'd
value?
be like, you're a doctor, bro. See, you just said perfectly my issue.
Yeah.
Is like the doctors should exist outside of a market. It shouldn't be market. Like the medical field, the healthcare should not obey any type of fucking market. that is patently, I think, immoral. Honestly, I think it's immoral when you introduce a market into something like healthcare.
Yeah.
I think it's
And
bad.
to me, as long as you get a certain standard of quality healthcare for cheap, I'm fine
That's
with
great,
the richest
but you'll
people
never,
being able to pay
you'll-
additional money.
You won't get that
get a
if
top dog.
you'll get the second half. You won't
Yeah.
get that as long as there's a. You won't get that, but you will get the rich
Well-
people get the top. You don't. I'm telling you, in practice, you won't. That won't exist.
Yeah.
You get what I'm saying?
I do get what you're saying, but in that case, that's the issue, not the top people
yeah,
getting
but
the top dollars.
what I'm saying is
Yeah.
that issue will never. You can't have the system you're describing without that issue. Like it just won't happen. It will fall apart every time.
Okay. I think that's reasonable.
There's no case where it doesn't happen. There's no like it just is that way. But it just becomes that.
All right, let's move on.
Let's I won that.
Because
one.
I think we both have.
I think I won that one. We'll
see.
clip it and see if people
I
comment.
think I did fine.
Yo, Parker, what do you think of that argument?
Because I'll say when I lost the argument, I feel like that was even. But okay.